All right, in this video, we want to cover some basic terminology that we use to describe infections, and these terms generally relate to the pattern of infection. So we'll go through pieces of terminology one at a time and provide some examples, and then we'll think about how we can use this terminology at the end. So patterns of infection. Let's start with something we call a localized infection. All right, so what's a localized infection? Localized infections are confined to one organ system or part of the body. And when we say confined, we mean the microbe that is causing the infection, the bacteria or the virus, is confined to that one part of the body. So we find the microbe in a single place. So let's think about some examples of localized infections where the infectious agent is located in just one part of the body. And a really common example is a boil on the skin. So we have an image here to represent maybe this fellow has a boil on his shoulder affecting the skin. So the bacteria are growing in the skin, they're causing inflammation and disease to that one part of the body. Right? Other examples of localized infections might be things like pneumonia. So pneumonia is an infection of the lung. There's a bacteria there affecting just the lungs. An ear infection. So bacteria might overgrow in chambers within the ear, causing inflammation and pain. Those bacteria are localized to that one spot. A wart is another example of an infection, this one caused by a virus, which causes your skin cells to overgrow, creating this wart structure. Again, only one part, one location on the body is affected. So those are localized infections. Let's next think about a different kind of infection. We'll call these ones systemic infections. So what is a systemic infection? So a systemic infection affects multiple organ systems or parts of the body at once. So localized only affects one. Systemic infects multiple, more than one. Often all of them, but it doesn't have to be all of them. And what makes an infection systemic is usually that the microbe has gained access to the circulatory system, the bloodstream. And that has allowed the infectious organism, the bacteria or virus, to gain access to every organ system of the body. That's because our circulatory system touches every organ system in the body. So the most common way that things become systemic and spread everywhere is by getting access to the circulatory system. So here's a little image. Again, systemic infections are shown by having access to the circulatory system there. So what are some examples of systemic infections? Well, one particularly common one is called sepsis. So in sepsis, bacteria are growing in the blood. They're gaining access to all sorts of organ systems. This can be a really dangerous kind of infection. And so sepsis is a really common systemic infection. HIV/AIDS is another systemic infection. Because the HIV virus attacks white blood cells, specifically T cells, that virus is everywhere that T cells go. And that's, again, T cells, blood cells are going to all parts of the body, so they're affecting all of the organ systems. A non-microbial disease that would be systemic is sickle cell disease. So when red blood cells take on this sickle cell shape, that affects any number of body functions all over the human body. And so sickle cell disease is systemic. So we've got localized infections. They're affecting one organ system. The microbe is growing in that one place. We've got systemic, where the microbe is growing all over the body, affecting lots of body systems. The next kind of pattern of infection we want to have the terminology for is a focal infection. So how is a focal infection different? So focal infections are just a special kind of localized infection. So we know a localized infection is where the microbe is confined to a single part of the body. But what's special about a focal infection is that the microbe's exoenzymes or toxins damage other parts of the body, far away from where the bacteria is growing. So here's an example, a diagram to illustrate a focal infection. So in this case, some microbe is growing in this fellow's throat. The bacteria is confined to that one region, but it's releasing something that transmits to the heart and causes heart damage. So again, it's not that the bacteria is moving to the heart and damaging the heart. That would be a systemic infection. It's that the bacteria is stuck in the throat, but it releases an exoenzyme or a toxin that damages the heart. So what's an example of a focal infection? This image demonstrates a really good example, and that example is strep throat. So we treat strep throat really aggressively with antimicrobial drugs because of these risks that the infection has for causing these far-flung effects through focal infection. So strep throat is caused by Streptococcus pyogenes. That bacteria is only growing in the throat. Right? So again, the bacteria is only in the throat. However, other organ systems in the body are damaged. For example, Streptococcus pyogenes can cause heart damage. We call this rheumatic fever. Streptococcus pyogenes can cause kidney damage. We call this glomerulonephritis. Streptococcus pyogenes can cause a widespread skin rash, and we call this scarlet fever. So again, the bacteria is limited to a single location, but it is having these far-flung effects damaging the host. So that's a focal infection. Let's add just two more pieces of terminology. The next one is a mixed infection. Mixed infections are infections that involve more than one type of microorganism. So at least two microbes growing together to cause an individual harm. So here's an image in this person's intestines. We've got various microbes growing, causing harm. Another example that is particularly common are cavities or tooth decay. In science, we call these dental caries. And so in this disease progression, several microbes, Streptococcus sobrinus, Streptococcus mutans, and species of lactobacilli, all grow together in a biofilm. And only when they grow together can they have the effect of damaging the tooth enamel, leading to a cavity. We'll talk more about cavities when we reach the disease portion of our course. So those are mixed infections, when more than one microbe works together to cause a single disease. The last thing we should be comfortable describing or using to describe infections is a secondary infection. So a secondary infection arises only after a previous primary infection weakens the host's defenses, allowing some other organism to cause harm. So let's think of an example of a secondary infection. We've talked about one previously in our course when we addressed superinfections, and it is the case of a yeast infection. So this is common in yeast infections that there's a primary infection, often a urinary tract infection, that weakens the host's defenses and allows another microorganism to overgrow in another part of the body, the vagina, leading to a yeast infection. So the primary infection weakens the host, and it gives the opportunity for another microbe to cause infection elsewhere, a secondary infection. Another great example, we used as an example for another piece of the terminology, is HIV/AIDS. So the HIV virus destroys T cells, weakening the host defenses. And HIV/AIDS patients do not usually die of the HIV infection. Rather, they die of all sorts of secondary infections. Things like pneumonia, for example. Because the host defenses are so weakened, they're at much higher risk for all sorts of other infections, secondary infections that harm them. Another example of a secondary infection is pneumonia. So whenever anybody gets an upper respiratory tract infection, like a cold or a sinus infection, that creates an environment in our respiratory tract that makes it more likely for microbes to get down into our lungs. And as soon as microbes begin growing in our lungs, that's called pneumonia. So pneumonia is a quite common secondary infection. And I hope what you've seen through these examples is that these pieces of terminology can be put together. So we've described pneumonia as both a localized infection, because it's a microbe is growing in the lungs, harming just the lungs, so it's localized. But it is also, or can be sometimes, a secondary infection, because it only progressed after a primary infection weakened the host defenses. So in some cases, we'll put some of these pieces of terminology together, right? We saw that HIV/AIDS was both a systemic infection and it leads to many secondary infections. Okay, so we'll leave it there. As always, please let me know if you have any questions, and I'll talk to you all again very soon.